Antipsychotics are powerful medications that are intended to treat serious psychological afflictions such as bipolar disorder and schizophrenia. Antipsychotics are not indicated for depression and irritability, but are sometimes provided off-label for such psychological issues. Whereas antidepressants work by increasing serotonin levels in the brain, antipsychotics work by suppressing the production of dopamine, which is the most important pleasure and reward hormone, and also plays a big role in the way that the patient responds emotionally to stimuli. One of the primary reasons why antipsychotics cause sexual dysfunction is because they encourage the production of prolactin in the brain, which both makes it harder to have an orgasm and can inhibit sex drive. Similar to antidepressants, antipsychotics also suppress acetylcholine activity, which is strongly associated with sexual dysfunction. It can sometimes be difficult to figure out the root cause of sexual dysfunction in patients that take antipsychotics because psychological conditions that lead to the prescription of antipsychotics often cause psychological issues as well. Antipsychotics have a much higher incidence of sexual dysfunction than antidepressants. Research shows that anywhere from 45% to 90% of patients experience at least some level of sexual malfunction. Like antidepressants, sometimes sexual dysfunction is a sign that the patient is taking too much medication and would benefit from a lower dose. Also, different antipsychotics control dopamine through different mechanisms, so changing drugs can help. For patients that have been prescribed antipsychotics for irritation or depression associated with Alzheimer's, it is important to understand that when doctors prescribe antipsychotics off-label for this purpose, they put the patient at significant risk of death for patients that suffer from dementia. Benzodiazepines are used for a number of purposes, including the treatment of muscle spasms, irritation, insomnia, and anxiety. They are also used in order to prevent patients from experiencing seizures. These drugs are frequently referred to simply as tranquilizers. As you may have guessed, benzodiazepines primarily impact sexual function because they suppress the body's ability to react to stimuli through their tranquilizing effect. They reduce sensation as well as excitement and libido. There is also evidence that benzodiazepines can suppress the body's production of testosterone, which can prevent both sexes from getting the most out of sex. The sexual issues most highly correlated with benzodiazepines are trouble climaxing, erectile dysfunction, painful or uncomfortable sex, and reduced pleasure from orgasm. Some patients are prescribed benzodiazepines when they could benefit just as well from other treatments, which don't require the powerful psychological drug, especially those that have issues with mild insomnia or anxiety. For example, for many patients, melatonin is all that is needed in order to restore normal and healthy sleeping patterns. Also, for patients with more severe anxiety issues, antidepressants or other forms of treatment may also be effective without contributing to sexual dysfunction. H2 blockers are medications which are used to treat digestive disorders, including acid reflux, stomach ulcers, and other stomach and intestinal conditions. Patients that take H2 blockers should be incredibly careful because taking the drugs for an extended period of time can lead to both impotence and breast enlargement in males. Different H2 blockers are associated with different levels of sexual dysfunction. For example, Tagamet is the H2 blocker which is most powerfully associated with sexual issues, including erectile dysfunction, reduced sex drive, and suppressed sperm count. Other H2 blockers such as Axid, Pepcid, and Zantac also have these risks, but they are not as severe. H2 blockers are the most effective means to treat many gastrointestinal conditions, such as acid reflux. There are some things that you can do to improve your sexual function while taking these medications, however. For example, making the effort to sleep better and eat better may be all that it takes to get your sex drive going again. Taking melatonin at night to balance out your circadian rhythm and hormone production can also be highly beneficial. Anticonvulsants are primarily prescribed to patients that suffer from epilepsy in order to prevent seizures. They can also be used for migraines, nerve pain, and other forms of chronic pain. One off-label use of anticonvulsants is for patients that suffer from bipolar disorder, although this use has not been approved of by the Food and Drug Administration. Like many other medications, anticonvulsants can directly contribute to testosterone deficiency and can suppress sexual arousal in both sexes. In addition to this, anticonvulsants can also inhibit the ability of the patient to achieve orgasm. In the recent past, the primary anticonvulsants available by prescription were Dilaton and Tegretol. Newer medications provide the same benefits with a lower risk of sexual side effects, including Topamax and Neurontin. If you still take one of the older anticonvulsants, you should talk to your doctor about changing treatments. Of course, many patients suffer from testosterone deficiency for reasons other than the medications they use. Also, many patients are forced to take drugs that suppress their sexual function for health reasons. For these patients, low-T treatments such as testosterone creams, patches, and injections can help enhance sexual function in spite of these issues and help patients engage in more passionate sexual activity. Many patients may also benefit from erectile dysfunction medications, such as Levitra, Viagra, and Cialis. If you are suffering from erectile dysfunction or low T, there is no reason to resign yourself to the condition. Talk to your doctor about your options. If you found this video informative, please press the like button and subscribe to the channel. To learn more about health and wellness regarding testosterone replacement therapy or hormone replacement therapy in general, please click the link below in the description.